everyone, it's your favorite couple. I'm Jay Ferguson.
And it's Antoine Battle here.
And it's a Ferguson Battle. So today we want to come to you and talk to you about getting tested.
HIV tested, that is.
So we went
August.
Was it August? Okay, yeah. We went back into August and we went together. One thing I don't have a problem with is asking the question, when was the last time you've been tested?
So let's share that story. So when we first met, Jay came over and we were watching something on television, Love at First Night, actually. It was my first time ever experiencing this particular web series. Great web series if you ever want to watch it. And there was a scene where one of the characters find like some pills or something, right? And then he just naturally assumed it was pills for his HIV.
Right.
But he ended up asking in a very nice way, and Jay just straight out asked, "So, when was the last time you've been tested?" Caught me off guard, but I'm okay with it. And I was like, well, and I went to count back the months of my last physical, which I go every year to get. And he's like, "So what's the results?" And I told him, that I am negative. And he just was like, "Oh, okay." But in my mind, I'm going, wow, no one's ever just asked me that straight up. And after I gave my answer, he was like, "Okay, great. We'll go in August together." So very interesting reaction. But what was your thought of me just telling you I would go with you?
Well, one, I appreciate it. Another thing is, like, sometimes I sit back and I don't think about the things that I ask. And that's probably one of the things, because a lot of people are not comfortable with that.
Mm-hmm.
And for you to be so open and just like off the back, like, yeah, this is negative, and I was tested this thing. You don't get that from a lot of people.
Mm-hmm.
For me, you can ask, I'll tell you, it doesn't bother me. I think maybe if my status was reversed,
okay,
then maybe I would have some drawback, like, oh, I don't want to talk about that. Very sensitive, conversation, but what if, as you say.
As I say. I think that's a great thing you bring up. Like, oftentimes when people are in the positive status, maybe they don't want to talk about it for whatever reason. And we can understand that, it's something that you are dealing with at that particular time.
It's a very touchy.
Yeah.
I mean, especially if you are experiencing it.
Yeah.
Very touchy. I am negative, but I do have friends, or I know people that is positive. I mean, just keep yourself up, take your pills. I mean, live a long life,
Yeah, I think for me, I do the same. Like, I know people, and I can appreciate when they want to talk about it. But I think, in the community, the gay community specifically, I think it's something that can be more addressed.
Yeah.
And not make people feel as if they can't talk about it. So in that night, when we talked about it, although I knew what my status was, it was very shocking and somewhat uncomfortable, but it shouldn't have been. But it was, because I was shocked by it, and the reality of it, but I can appreciate it. So fast forward, we're going to try this dating thing, and then we go together. And I honestly, truth moment, never been to a clinic. I would always go to my primary care doctor, draw this blood, pop a good vein out, and I'm going to look at it, make sure, you're doing everything right, and wait on the results. And that alone can be pressure in itself.
Yeah.
And I'm sure maybe a lot of you all maybe be in that situation where it's like, okay, we're going to get this done. But it's just thought. And I know I'm taking care of myself the best I can. I know how. But it's still just a thought, right? So we go to this clinic and I'm like, okay, I'll go. Never been to a clinic before, so you're going to have to find this. He has a date ready. Date is set.
August 11th. August 11th, I say, we have an appointment. All right. So we go to this clinic. I'm not giving any free.
I don't even know the name
free
of it.
plugs. But yeah, we go to this clinic and we get in there and we just sit there. Well, we sign in, we get there. And first he came out and he was like, well, who's first? He said, who wants to go first? And so it was like, well, did we go together?
We did not. So the first time, well, when he asked that, he was like, oh, you can go. And just like shooed me off to the back.
So listen, he went back there and I was up front and I'm looking at the time like, shit, they've been back there a long time. Like, what the fuck? But anyway.
I would have to share my back there experience, actually.
So, yeah, I was just sitting there and finally they came back and I was like, oh, it's gone a long time. It's like, yeah. So he gave it to me. I looked at it and, okay, negative, cool. I go back there. I already knew what I was, I knew my results pretty much. Mm-hmm. So I went back there and tested.
We were back there together.
Oh, we went back there together when I went.
Because I was not waiting in the lobby, I guess, as long as I've had him wait.
So he was like, what, I think, did you ask? Or somebody asked if it was okay if we both go back. He was like, yeah, sure, come on. So we went back there and...
Really sweet guy that tested us.
Yeah. And so, yeah, as he was testing me, do you, asking me all types of questions. And, I really didn't have anything to hide from him. So, yeah, I was perfectly fine with him being in the room with me as I was being tested. But, what?
Nothing. I'm just
But, yeah, overall, it was a great experience.
It was very educational for sure. Like the guy was asking, so again, first time in the clinic for me, I normally go to primary and primary doctors just, how are you feeling? Knock a knee, hit an elbow, stick your tongue out, draw your blood, you're done. But at the clinic, it was, what's your understanding of safe sex? And for me, I'm just like very traditional. I would say I'm not a very expeditionist, for lack of better terms. So I'm like, wrap it up and keep it safe. And he was like, well, what if I tell you you were wrong? I'm like, well, tell me something.
So the question was,
what's safe sex to you? What does it mean?
Yeah. Or I think he said, what is the best way to have safe sex?
Oh, yes. So me, wrap it up, be careful. I don't know. And he tells me I'm wrong.
For me, I said abstinence. And he also said wrong for me.
Yeah.
But the correct answer that he was looking for
was to practice the safest way for something you enjoy. And I was like, okay, well, define it for me. And he's like, well, people enjoy sex in a variety of ways. Like he said the most obscene things, like men like to have sex with women on their periods. Never heard of that? Not experiencing that. People like to...
Clearly.
Right. People like to watch others have sex and they'll get off, or there's S&M, or there's needle sharing. And, not thinking about all of that when the question was asked. However, after speaking to him, I was like, okay, well, that makes sense. It's being safe in what you enjoy, because there's a variety of ways in which people enjoy their bedroom. So I'm like, okay. So that was educational. So then I was like, well, lean in. How you feel about PrEP? And that's when he was like, so let me tell you about this situation, bomb drop. And I'm sure a lot of us have heard about PrEP. I believe the drug itself is Truvada. Hopefully I'm pronouncing that correctly. And then he was like, well, I wouldn't recommend it. So like, okay, well, tell me why. And do you remember what he said?
Well, the reason why you don't want to be on PrEP is because it's kind of like once you start PrEP, you have to continuously take it. So you have to take this pill every
day. It's a cocktail.
Yeah, you have to take it every day as if you have HIV virus. So if you have to take it every day, I mean, like, and once you stop taking it, then your body becomes immune to it, and it no longer works for you. So you're putting yourself at risk when you get on this pill.
Yeah, so he, like, in sense for me, he was like, okay, so HIV non-detectable person, for example, he's like, this person may be on a daily cocktail pill every single day, but every 6 months they have to get their checkups, and then they have to get dental visits, because you have to check your gums and all that, vision exams, and then your lab work, of course.
Regular checkups.
Same thing when you're on PrEP. He was like, listen, you're going to have to take it every day. You have to get your checkups regularly, get your blood screened, dental checkups, vision checkups. And he's like, so what does that sound like? And I was like, well, I don't mean to say this rudely, but it sounds like a person that's HIV positive. He's like, exactly. He's like, so you're doing the same thing. And for me, I can understand it. But I also understand that there's a lot of people that's on PrEP for whatever reasons that they choose. But at the time for us, we chose not to. And I think for us, it was continue to be safe in what you enjoy in your own bedroom and in your own privacy. Now,
I do not knock anybody that...
Honey, I forget to take a one a day. Okay, and a B12 vitamin just on the regular GP sitting on the counter staring at me. I know I'm going to forget to take that, baby. Unless Siri pop up and say, take your pill, it's going to be missed. For me.
I don't knock it. I mean, if you decide or if you make the choice to get on...
do your
PrEP,
research for sure.
Yeah. It's a lot of people, it's PrEP out here. You can get on PrEP. You get on PrEP. Yeah, you get on PrEP. You take this pill. You have to take it for the rest of your life. I mean, like, if you stop taking it, then...
So tell me how you feel about this. Because I was talking to a friend the other day, and he was saying that he hear people that he know that choose to go on PrEP because they feel like they can now have sex with anybody. Does not give you the white flag to go be promiscuous and think you can just sleep around with anybody. Like, I just don't want people to think that this drug
is going to prevent. Yeah, this drug is supposedly it's supposed to prevent you from contracting HIV, the HIV virus. Getting on this drug just so that you can
sleep with anybody,
that's careless. I mean, that says that you really don't care. Sex should be something that you enjoy with your partner, and not just be having,
willy-nilly.
Yeah, just with everybody. I mean, do what you do. Hey, it is what it is. But I don't know. It's just not for me.
Yeah, I was trying to look and see what I could find on it. And most research say, of course, consult your doctor. So we are not the experts, wish I was. But, it talks about this medicine does not cure it, of course. Consult your doctors. There are risks when taking this. Weigh your options. And just really, for me, I just would want people to do their research. And for me, that whole experience with you was very, honestly, the first time I've ever done testing with someone. So that meant a lot. So just FYI.
Oh.
I've never done that. Like, just kind of sitting in a lab, just normally I'm by myself at the doctor's office, wait on him to email me my results. Most times to tell me I need to lose weight, I like to eat. That's about it. But hopefully he says the same thing this go around. But, I think it was very educational, and I will go back. So we have our next doctor's appointments because it's time to get our annual visits before the year ends, and that's coming up this week. Mm-hmm. But the next time we go, we'll still go to the clinic. I think it's good to still go regularly.
Oh, it's time.
Baby, that's why we're going to the doctor this month. This is the 6th month, babe.
Okay.
Isn't it? Oh.
No, it's the 3rd month.
No, babe. You go every 6 months.
Well, for the doctor visit. Yes.
So we're going to the doctor. They're going to test us the same, and then we'll go 6 months again.
Yeah.
That's who tried to confuse me, y'all. That's what we agreed on.
Yeah. But we also agreed on the 3 months. Go every 3 months.
Okay, well, we'll go to the clinic for that.
So you go to your regular doctor every 6 months, and then we'll go to the clinic every 3 months.
Okay.
So for the clinic, we're not going to go this month.
No, we're going
because we're going to the doctor.
Yes.
And then our 3 month, we'll check in.
Get a little swab in, let them check us this DNA out. Hopefully they ain't trying to make a doublemint twin of me.
You're so crazy.
I mean, shit. But, ultimately what we want to just talk about that experience.
And just put it out there, get tested. If you have never been tested, if you're scared to get tested, go with a friend. Hell, you can hit me up on Instagram. Hell, I'll go with you if you in the Houston area. Or my baby will go with you, right? Since he's not scared.
No, I'm not. I think it's important to do.
It is.
I think it's very important to talk about. I wish we in this community talk about it more.
And hold on, baby. It's not just, and we're not just talking about homosexuals. Mm-hmm. It is also for heterosexuals as well.
It is for human beings.
Straight, gay, bi, trans, everybody. Go get tested if you have never been tested.
Yes, I 100% support that.
Great.
So we got tested. We're come back clear. We go again soon this month. Friday, where we'll be in there getting it all drugged up. Let them see what a little Antoine look like. Mm-hmm. These good old arms. But thank you for watching it. I hope you guys go out there, do some research, go get tested,
and hopefully this video was informative for you. When you go and get tested and they ask you all of these questions, you will know how to approach it or how to answer them. Mm-hmm. But yeah, definitely get tested. There's no other way, or just get tested. I mean, I can't say it enough.
Yeah. But knowing is best.
It is. And you feel good when you do know. Yeah. It's like a burden lifted when you know. And for you to go in there and get tested and they give you your results right then, you're like, feel good. They will definitely ask, some will ask you, how do you feel? And that's your time to It's like I remember my first time when I went to go get tested, that's how I felt. I felt like, because it's been a while. It had been maybe 2 years since I had been tested. And when I finally went, it was like, okay, yeah, happy.
I like the instant results.
Yeah.
Yeah, just go ahead, fight
it. It beats the hell out of
that 2-week wait.
Getting tested, you go home, you're waiting and waiting and waiting and waiting and waiting, and when you finally get it, you're like,
okay. Get tested, everybody. Much love to all of you all that watch these videos. We really appreciate it. Continue to like, subscribe, share, tell a friend. I think there's something about a little bell. Comment below.
Make sure you hit the bell so every time we post, you will get our notification. Also, make sure you check out our YouTube page. I mean, not YouTube. I'm sorry. This is YouTube. Our Instagram page at The Ferguson Battle. Sometimes we have contests. You know, you never know. We may throw a little something in there.
Or a cool little picture of us.
Right. Shout out to... Who want to shout out?
Let's see here.
Shout out to Jeremy. Shout out to Jeremy. He's one of our biggest fans. He's on our Instagram page. Also, subscribe to our YouTube page. Watch every video. Comment.
Tell us about
it. Yeah. Also, Regina Harrigan. I just found out her whole name.
Okay. Come on, government.
Sorry, Regina. But Regina Harrigan, and then we just got a new subscriber who is so excited.
Who could that be?
Lysandria Thompson.
Oh, hello there.
So she's now following us. She was actually one of our contest winners. So congratulations to you. And shout out to you. Continue to watch our videos, and we will continue to post or try to post regularly. So that's it for this segment. We thank you guys for watching and hope to see you next time. Make sure you subscribe, like, comment, and share.
That's who's going to get us the people.
Yes. Bye.